responsibility. And it makes you want to live up to that. Like, people depend on you, not just your patients, not just your patients' families, but like the colleagues you work with. Like, you have to meet up to their expectations because they feel relieved when you show up, like that the help is there. It's like the cavalry is coming in.
Hello, and welcome to the Art of Emergency Nursing podcast. This is where we share stories for inspiration, entertainment, and encouragement, because we all know emergency nurses have the best stories. Now here's your host, Kevin McFarland.
Hey there, everybody, and welcome back to the Art of Emergency Nursing. This is your host, Kevin McFarland. I want to thank you so much for listening to this episode. Thank you for listening to all the episodes. Hopefully you're subscribed on your podcast player of choice to make sure you don't miss an episode. A couple things I want to ask you to do for me, if you would, if you have some time. Please go to iTunes and leave a rating and review. It's one way to help the show out, help us get noticed and exposed to more people. Now, the most important thing you can do is share this podcast with your friends and your peers. Let them know about the show and encourage them to listen as well. That's the thing that helps the show the most, is you getting the word out and telling people what you like about the show and finding other people who might like it as well. A good referral from you is gold to me. I have a great episode planned for you this week. My guest today is a young, inspiring nurse who's inspiring a whole new generation of new nurses who want to get into flight nursing. She has had quite a following on Instagram and even has her own blog. I'll put a link to that in the show notes down below. She's been an ICU nurse, an ER nurse, and now works full-time in flight. You are going to love this episode with my friend, Steph.
Well, my name is Stephanie. I am a flight nurse in central Pennsylvania. I've been a flight nurse for about a year and 3 months. I've been nursing total for about 6 years this year. Started in the intensive care unit. Liked it, didn't love it, always wanted to be more in the emergency setting. I did transition not too long after that into an emergency department, suburban, small community kind of emergency department. Saw all our share, pretty busy, loved it, thrived in it. But like my goal was always to end up in flight. Back when I was a teenager, I was actually an EMT first. Going through a real bad breakup, couldn't like really get over it, pull myself out of it, put myself into school to be an EMT. And the funny thing is I failed my EMT class like 2 weeks in.
Oh my gosh.
2 weeks in. I know. It's really embarrassing to tell, but it's actually a really inspirational story of perseverance. Failed my EMT class 2 weeks into the class because teenage girl, too busy talking and flirting with the fireman, just couldn't get my head in the game. But I talked to the instructor, and the general policy for this college was that you didn't get to finish the program, that you were excused. I told him, I'm sorry, I didn't really take it seriously like I should have, but this is what I want. So he's like, all right, you can audit the rest of the class. So I stayed through the rest of the class. I didn't get to obviously test for my EMT with the rest of the students. Came back the next semester, worked twice as hard, and then passed everything the first try.
Good for you.
So yeah, but like I said, it was just a story of perseverance and kind of realizing, well, I goofed, and then kind of learning from it. So from there, I dabbled in a bunch of different majors in college. I thought I applied places to be a nurse, got into a bunch of places to be a nursing student, was like, I want to be a doctor. I don't want to take orders. I want to give orders, too cool for that. So started at a college in Philadelphia, piled on the course load. And I'm like, I hate this, dude. I literally took 22 credits my first semester, 22 credits my second semester.
Holy cow.
Oh no, it gets better. Of all those credits, I literally passed 4 credits.
Oh, ouch.
Yes. So when I tell you that it's a story of perseverance and kind of buckling down there and kind of, really dedicating yourself to your career, you can get there. You just kind of got to look at your life, have that introspective, yeah, that wasn't the best choice I've ever made. So yeah. Anyway, I transferred to another college up in the middle of more rural Pennsylvania, kind of central area. And my mom was like, you're going to go live at a firehouse. And I'm, what? I'm not going to live on campus. And she's, yeah, and you're going to paramedic school. I'm like, all right. well, I guess let's do this. So I started in paramedic school. I was living at a live-in program, which was fantastic because I didn't have to pay room and board, and ran calls overnight as an EMT, and basically was going to school to do all my stuff for paramedic. Well, I met my husband then, and then started shacking up with him or whatever, and I changed my majors to nursing because I really wanted a bachelor's degree. So the funny thing is, I actually came full circle. So I started with the applying to be a nurse, getting in everywhere, dabbling around the different things, and then coming back to nurse. And that's where I stayed. And then every semester, I worked harder and harder and figured out how to be a student and figured out, what worked for me. And I like to share that story with people because, too many students anymore just get so disheartened about it all and just give up too early, but you really don't have to. Anyway, I digress. So all that. And while I was running calls and doing all this very early on, I want to say probably 2009, some of my earliest role models up in this new area that I moved into were flight nurses.
Okay.
I interviewed at another firehouse to be a live-in there, and the fire chief there was a flight nurse, and I thought, oh, that's pretty cool. I had read books about it, but it didn't seem like something attainable. It just seemed like something you read in books, something you saw on TV. And then I'm like, oh, that's a real thing. Okay, cool. And it wasn't until I was on a call. It was a horrific call, really. It was, involving kids, involving a car crash, ejection, fire, pretty much every worst case scenario you can imagine. There was this call, and we had to land 2 aircraft and load both of these kids. And I remember seeing this one flight nurse, and she's a friend of mine now, and I always joke with her about this, seeing this one flight nurse getting off this helicopter. And it's like Flight Nurse Barbie, for real. Like, she just got off this helicopter, and the rotors are running. You're waiting for some dramatic music to play. She just whips off her helmet, and her hair is blowing, and it's like some kind of Baywatch, but Rescue Baywatch or something like that. And I just remember her coming up and taking this patient. She's just calm, cool, collected, really right to the point. And I kind of 19-year-old me is just kind of sitting there wow.
That's kind of cool.
I want to be her. She's really, really cool. I mean, I want the fan that follows me around. How do you get that? But not only that, it was her demeanor, Kevin. It was just spot on. It was the calm in the storm. We're all there. Obviously it's a kid call, and kid calls are just the worst calls.
Absolutely.
The calm in the storm arrived, and I just remember this team coming in their jumpsuits, and always the jumpsuits. It's like the sex appeal, I'm pretty sure, of the nursing world is the jumpsuits show up, and it's oh man, it's jumpsuits. It was that calm. I remember her face, and I'm it's gonna be okay.
That's
because
cool.
And this kid was not in a good way, but. And unfortunately, that was a really bad call. That one of the kids did pass, and the other was a good save. And I remember talking to one of the kids later on. He approached me on Facebook, and I was oh, I'm not sure how to address this. And he was very thankful for all of it. But it's just that was one of those defining moments in your career that you're just yeah, that's it right there. Put a pin in it. It's right there. And then ever since, I worked my butt off throughout nursing school trying to okay, here's what I got to do. Here's the next part. Here's the next part. But here's the thing, I just, trying to get all these puzzle pieces to align. And then, I didn't get my ER job when I interviewed right out of nursing school. They told me no, we don't really want you. We're going to have another applicant. So I was I didn't get my first choice job, which was heartbreaking. Which, don't get me wrong, I loved my ICU job. The nurses I worked with in that ICU, fantastic. But alternatively, there was a couple small hitches there. There were a couple nurses that kind of did the nurses eat their young kind of thing, and really kind of. And it defined what I didn't want to be as a nurse preceptor, in my own career. I remember, but at the same time, the ones that precepted me were fantastic. I remembered that in my career too. So it was just kind of a neat journey, Kevin, because it's a roller coaster of emotion through all of this, and it's still so neat on my socials to kind of have all these people asking me, like, how do I do this? And I'm like, well, here's my story. And my story is like a hot mess. So, I mean, make of it what you will. There's a million different ways to skin this cat. And I'm really, really sorry for anyone who really likes cats. I love cats, by the way. There's a million ways to skin this cat. So, I mean, this was my way. It's not necessarily the right way. There's probably a lot of wrong way in my story, but I mean, it's just I overcame a lot to get where I was, and most of it was myself and the own barriers I set for myself.
Yeah, that's really cool, and it's so cool that people are now asking you advice on how to do something you think is, that you were the same way, that you were like, wow, that's kind of cool. How do I do that?
Mm-hmm. And what was nice is that, here I am, and I will never, ever say I am not blessed. And here's why, because I had all the right people in all the right places at all the right times to help guide me. From day one in this new city, the very first person I met turned out to be the best mentor I ever had. I work with him still today. He was my internship employer for my master's degree. He's
Nice.
still a personal friend. He is the coroner for our city, which I'm not sure how I feel about that, by the way, if that he's a flight nurse and he's the coroner. I feel like that's kind of like that
conflict of interest
there. Yeah, right. And I'm sure if he ever listens to this, he'll have to kind of just shake his head at me because he knows me well enough. But he's always been my mentor. And then I had this other mentor, like this flight nurse Barbie, and she'll probably shake her head at me for that too. But she helped me get this job because she told me this is what you need, and this is, so I've had all the right people at all the right times helping me along the way. But too often on my social accounts, I get asked by these people who just don't have the luxury of knowing people like I do. They don't have that person to be like, here's how it works. This is what I did. And I often feel very presumptuous for being like, I'm not obviously like the content expert in this. I'm very new to my career. But I think the whole novice aspect to my flight nursing career is almost appealing to some aspiring flight nurses, because they're kind of like, well, she's still new. So maybe she remembers like how she got in or something like that.
Absolutely.
Or it comes off less intimidating.
Yeah, I think that's probably true. I think it probably comes off a little less intimidating, and we just have so much more access to people now too. I mean, when you were starting, social media probably wasn't as easy to contact people that you just don't know real well.
Well, and I honestly wouldn't have thought about it.
Yeah.
But, not necessarily. I had a LinkedIn. And I kind of networked a little bit, quote, networked. I don't know what that means, but we linked up. I don't know if that actually helped me, but we're linked.
That's cool.
It's something, but at the same time, it's funny because I have a really touching story. Is that I have somebody on my Instagram account who reached out to me. I want to say a month and a half, maybe or so ago, and asked me how do I get a job? And I'm like, I was trying to tell her what worked for me, and she was actually the inspiration for me writing the blog. Was that she asked me these questions, and I had been asked the same questions over and over and over again. And I just and it's such a long answer, as you could hear from my story. It's such a long answer that I'm like, there's got to be a better way to answer this. And that was, the inspiration for me, starting my own blog. So I basically told her and helped her look for jobs and referred her to other people I had networked on Instagram, so that they could help her. Cause I think she was looking at jobs in Louisiana, and I knew a flight nurse in Louisiana from networking. So I put her in touch with him, so he could answer a little bit more questions for her. So when she finally got a job interview, she came to me again. She was like, "Hey, I got an interview," and I'm like, "That's fantastic!" And I celebrated with her because that's just the most great news for somebody who wants to be a flight nurse, because there's a lot of supply and not a lot of demand, unfortunately for us. So I prepped her for her entire first interview. And, she went in, she felt super confident and didn't get the offer the first time. And I'm like, hey, there's no shame in that. It's just keep going, because it's going to come eventually. You're going to get it eventually. So she had another interview and she nailed it, and she got the job, and she messaged me and told me she got the job. And I my husband will attest to this. I was probably crying. I was like so happy for her. I'm like, here's this person I never met in my life.
And you're like so vested. You're like, oh, she's got to get it.
And it's not just her, Kevin. It's like, I have so many nursing students that just like reach out and yank my heart rate out of my chest, because it's like, it's such a weird feeling to be like this mentor or an inspiration, because here I am just like, look at my cool flight pictures. Look at the sky. Look at this cool like mechanical wonder I get to like zoom around in. And I look kind of cool in this flight suit. That's what it started out with. It was like this excitement for a job, but then it kind of turned into this like personal mission for me, is like, is to just kind of like have this message of inspiration, because like, you do, like, you don't understand how much good you can do and how much impact you can have just by existing on the planet.
It's true.
And there's just not enough people, I think, that want to try to inspire others. We often, I think, fear training or encouraging our replacements.
I don't get that. Like I just got back from SCLO, the ENA leadership meeting, and someone said, hey, this guy over here who's also from Texas, hey, this guy over here really wants to start a podcast. And I'm like, oh, let me go talk to the guy. And boy, I'll give him all the tips he needs, and I'll help shortcut what happened for me. And I was like, hey, let me help you out. I'll help you in any way I can. And that's just what you do. I mean, you're like, and he's like, oh, and then someone goes, oh, you're not afraid he's going to be competition? And I was like, no, there's plenty of people to listen to podcasts to go around. There's no competition there at all. It's just, I'm going to help him out if I can help him out, because that's what we do. That's what we're supposed to do.
And I've always felt that way. So I actually, a couple of years ago, started teaching EMT students. And, I'm really fortunate because one of my coworkers, a great paramedic I work with, is a director of the program now that I tried to go through back in the day. I feel like so like salty right now. But back in the day. So he took over the paramedic program. And he's starting up a critical care class for paramedics and nurses to try to help flush a little bit more out there in the community. And I get to help teach that now. And I feel like really honored. I'm like, here I am, like I'm still kind of a greenhorn, and I got asked to help with this. And it's like a really heavy, like responsibility, but at the same time, I'm really humbled. I've been very fortunate that I know a lot. Like when I was in the ER, I used to think I was the hot shit. So like, how when you're, after a while, you kind of filter in new people and then you get experience, you get very comfortable. And after that first, year or two, you're like, I got this. I can handle whatever comes in my ER. Yeah, I'll take that. Yeah, I'll take that. What? Over too many patients? I'll take that. All right. I don't like it. Break. Whatever. I don't need a break. I haven't peed in 17 days. I'm fine. But you get that kind of I don't want to say swagger, because I feel like that kind of makes it sound really bad, but you almost get that real, you get that flow and you feel really comfortable. And, I felt that, I felt like I was this big fish in a small pond. And it's not that I felt like I was better than anyone else. I wasn't, because I had worked with some real pro nurses. And my senior nursing staff, I couldn't have been anything without all of them, because they were just top-notch humans. And even still, some of our new grads would run circles around me. I precepted a girl who completely changed my views on, the BSN, the diploma nurse, the ASN. I was a BSN nurse. So, I came out of school, I'm hot shit. I got this. But I precepted this diploma nurse, and I was sitting here when I first told me, I'm like, oh gosh, I'm going to have so much to teach her. She's going to be so and then I was just astounded because oh my God, this girl was mad talented. She just came out, hit the floor, ready to go. Cause she was just, her patient care times were just fantastic. She had a lot of clinical time. They had a lot of focus on the bedside, and it completely revolutionized my entire understanding of the nursing education system and what we're doing to it. Don't get me I'm a huge believer in education. I'm not downing the BSN. I'm not downing the ADN. I'm just saying, I think we kind of have gotten to this point where our education system has really groomed us to look down on our counterparts with what we seem as lesser certifications and lesser degrees. But anyway, I kind of, like I said, I keep digressing, but so I had this diploma nurse who was just fantastic. And she just run circles, and she, her orientation went so smooth. I was so impressed by this girl. But so I had this entire pool, this pond, and I just kind of was feeling a little suffocated and smothered. But then I kind of moved to this new realm where is flight and critical care and pre-hospital, emergency, womb to tomb, neonatal. I have everything I could possibly think of that I have to be ready for. And then it's like being fresh out of nursing school all over again. You want to talk about humbling? I got humble pie served to me daily for months. And it still happens. It's just some days I have this weird imposter phenomenon where I'm like, they're going to find me out. They're going to find me out. I'm not worthy of being
any minute
here.
They're going to find out I don't know what I'm doing. And you're like, I think everybody feels that way though. I think everyone I've talked to, and I've talked to some brilliant people, and they feel the same way. They feel the same way all the time. So, hey, but yeah, no, it's so cool to be able to, mentor people and bring them through. And you're right. One of the best nurses I ever worked with, was a nurse named Bobby. And Bobby had been at the university where I worked. I worked at University of New Mexico Hospital, and Bobby had been there, I don't know, 20 years or something. And, she'd been there a long time. And I was like, she was just amazing. She was just all the patients loved her. She was the most skilled. She was the one you went and called when you couldn't get an IV or when someone didn't know how to do a procedure. It was like, go get Bobby. She was the expert. Right. Then one day I became a new grad nurse, and I was just off orientation. And I was working a shift in the ER, and she comes and grabs me and goes, "Hey, I need you to co-sign my chart." And I was like, why in the world would I co-sign your chart? And she's like, because I'm an LVN. I need a nurse to co-sign my chart. I was blown away. I had no idea she was an LVN. Had no idea. She was the last one working in the ER. And they only let her work there because she'd been there for 20 years and she knew everything.
Yeah, that's insane.
And I'm like going, what is dumb, dopey me going to do co-signing your chart when you've forgotten more about nursing than I know? And you're just like, I was just blown away. I had no idea she was an LPN. It never even occurred to me.
There's no such thing as Justa anymore.
Yep, you're absolutely right.
I mean, I know EMTs that have been doing this for God knows however. And the funny thing is once I got my PHRN, which is the Pennsylvania, in Pennsylvania, it's like a step above a paramedic. Okay. It's like the nursing pre-hospital licensure.
Oh, okay.
A lot of states don't have it. Pennsylvania does. Once I started doing that, it's funny because there's so many EMTs out there that I'm just like, wow, you know that? I didn't know that. That's crazy.
Right? Yeah, I remember feeling the same thing. Where there were techs that I worked with that were just amazing. They're just amazing. And I was like, wow. I remember one tech sitting there just popping off lab values to me. And I was like, geez, I don't even remember all those. So.
Oh, it's so true though. I couldn't, when I was working in the ER, I feel like techs were one of those resources that you just couldn't be more grateful for. So many of my techs, first of all, if they were ever taken away from me, I was lost. So I never wanted to take them for granted. We just had one leave a hospital I had just resigned from a few months ago. And her name was Nikisha. Oh my God, this girl, she had been there for a while and she just knew, she ran that place like crazy. She knew everything. She trained others and her attitude was just so spot on. And there was another one named Brittany, and same thing. She was just a very positive person, knew everything about that department. And it's funny how some of these techs, they can train the nurses because they just know they knew the physicians well enough to know what they wanted.
Yep.
So like for intubation setups, for suture setups, for different procedures, pelvic exams, they intuitively knew what different providers wanted. And they couldn't go into like the huge rationales, the deep critical thinking, but they knew their jobs, they knew what the role of the nurse was, they knew how to anticipate like 5 steps ahead. Whereas like when I first showed up and first came off orientation, I'm like, what's this thing? I'm looking at it, I'm like, I don't even know what this is, like splits. I don't even know what that means.
Yep. Yeah, no, for sure. I know so I was a tech before I became a nurse, and I worked at a local trauma center, and it was, at the time, the techs there did amazing things. They did IVs, blood draws, NG tubes, Foleys. For a long time, we did local anesthesia and suturing. And I was like, here I was a guy with a high school diploma, and I was doing suturing, and I was doing everything from simple scalps to complex facial lacerations. And I'm sitting there thinking, all I got's a high school diploma. And you're just like, this is crazy. So, and I remember when I was doing that for a while, and then eventually they asked me to start teaching it to the med students. And I'm sitting there going, okay, so here's me with a high school diploma going to teach the med students how to suture. But the university was smart. And if you know how to do the skill, it didn't matter what degree you had. It didn't matter what your background was. If you know the skill, teach the skill.
Oh, it's so true, though. It's so true. I mean, I know. I mean, I've taught doctors how to do IVs. Like, I mean, it's not a matter of a knowledge base. It's sometimes just a matter of putting your hands on something and understanding, like, it's this, then this, then this, then this. I mean,
you're absolutely right. You're absolutely right. So it's just a matter of what you learn and how you learn. And again, the nursing license just gives you license to learn. So.
Oh, absolutely. I'm a full believer that education is one of those lifelong things. And I'm pretty sure my husband's probably sick of this by now, but I'm one of those people that I've got 4 of the 5 BCEN certifications.
Good for you.
And I'm probably going to take the 5th this spring because I don't really know why. Just probably because like I want it. Only 5 people, or not 5, excuse me, only like I want to say 32 maybe in the country have all 5. And, now that I kind of found that out, I'm like a dog with a bone. But more than just that, I really enjoy just kind of learning new things, perfecting new things, and then, challenging myself. But I keep going back to school, and, I'm a real big passionate person about education, but I'm like, I can't really afford any more education. I'm doing the same job because I'm in my dream job. So looking at it, my DNP would be worthwhile if I kind of had a plan for it, but
Yeah. No, I understand. So which one is it that you don't have?
I don't have my CTRN, my certified transport RN, my CFRN, my certified flight registered nurse. Essentially, the tests are relatively identical. The CFRN encompasses everything the CTRN has. It has a flight physiology and aviation like operations component to it.
Yeah. Yeah. That's, I've always heard that those two were pretty close.
Yeah. So, I mean, like, essentially, all of the pathophys, the like EMTALA issues, the tests themselves are relatively identical. The only difference is the whole flight aspect is added on top of it. They still test about like ambulance transports on the CFRN because flight nurses do go to the ground occasionally, hopefully purposeful, but we do go to the ground. I mean, weather comes in, we very much have to be able to convert from air to ambulance. So we have to understand ambulance operations, just like a transport nurse.
It's just a matter of just getting that last one. So I bet you'll have it done by the end of the year.
Oh, yeah, probably. They're expensive.
They are. And then you got to keep up with them because it's, I look at, so I have two I have two, I have the CEN and I have the TCRN, but I let my CPEN go.
I just got that here recently, and that was a fun test to study for.
What did you use to study?
Oh, actually, this is a shout out to Pam Bartley because I used her twice, and I used her. I like med-ed seminars. They have a lot of lectures online. Jeff Solheim's usually a pretty good go-to. He's a real nice guy. I met him at ENA 18 in Pittsburgh.
Nice.
Yeah, real nice guy. Very nice guy.
Yeah, good guy.
Yeah, Jeff puts out excellent materials, so I always recommend Jeff. And then, I guess for the CTRN, I really like Flightbridge. Eric Bauer is very approachable. Puts his email out there. You're allowed to email him questions about things, and has a good social media presence, which, again, we come back around to that. Like, I feel like that's kind of the new way of things, is if you want to make an impression and help people, social media is kind of the thing anymore.
Yeah, there is a lot to that. I mean, there's certainly, and I mean, the others that you mentioned, Jeff Solheim and Pam Bartley, both have, a social media presence. Certainly that's part of their, and to varying degrees. It's part of their world.
They're kind of their niche.
Yeah. And it's nice to have that, because it's, it makes them really approachable and really easy to get in touch with. So, and they're both just wonderful people. Like,
absolutely.
So I like them both a whole lot. So.
Well, and that's the neat thing. Like I said, like the networking for nursing is actually pretty amazing. When you look at some of these communities on Facebook and Instagram, don't get me wrong, you get your share of toxic humans. You're just like real life, you're going to get your share of toxicity. But you look at the communities as a whole and how we kind of band together and uplift and such. It's really amazing. I mean, you look like the whole Nurses with Cards movement and the Show Me Your Stethoscope movement. And, I mean, the various fundraisers for different things that go out on some of these ER nurse pages. It's just incredible.
Absolutely. Yeah. I totally, I agree 100%. I think it's, they band together. If they could just stay banded together, they would be, they'd be unstoppable. Like if we lobbied the way physicians do, we'd be absolutely unstoppable.
Well, I challenge you on the flip side, though. So nursing has actually, we need to lobby better, but when you look at our lobby compared to the EMS lobby, we're decades ahead. I mean, you see these. So I love paramedicine and I love EMS. And like I said, I started in EMS. I have my foundations as just a little baby EMT, or a stretcher fetcher, ambulance driver kind of deal. So I got my start there, and I still volunteer as a I was going to say an ambulance driver. Oh my goodness. I still volunteer as an EMT at a local firehouse. And I don't get out as much as I'd like to, but I still try to mentor a lot of our live-in EMTs and such like that. But when you look at the struggles some of these EMTs and paramedics are going through, my flight paramedics, Kevin, do relatively the same job I do. Oh. And I'm making a lot more money than they are. And I don't say that as a brag. I'm saying that because it's an injustice.
Agreed. We used to joke a long time ago that, the only difference between the flight nurse and the flight paramedic was, $10 an hour. And of course it's much more than that now, but, you're absolutely right. I mean, they're doing the same job.
And there's a couple of things in their own way, like, about there's a big push to try to increase education requirements, but at the same time, like numbers are down because they're not getting paid their worth. And these guys, like on the streets, you look at them, and this is one thing when I was working in the ER, having come from that world, I always made it a habit of always saying, hi, thank you, just trying to be polite to EMS, because like their job is thankless. So, we kind of always kind of sometimes like do that sigh, like, oh, we have another patient. Oh, it's another nursing home patient. Oh, I've got so much work to do. And then sometimes, maybe we get a little frustrated with EMS. And, ultimately, we all know logically it's not their fault. And sometimes we hear the slip out of our own mouths, like, why did you bring him here? Well, obviously, we know why you brought him here. It's 911, EMTALA violations, blah, 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 blah.
Yeah.
But so we know why they brought him here, and we're not really taking it out on them, but you kind of look at the flip side is, maybe they haven't gotten a meal at all in their 12-hour, 24-hour shifts. And, this person's a frequent to them, however many times. And, they had to go pull him out of a hoarding situation in a bad neighborhood in the middle of winter from the third story out of a tiny bathroom. They're 400 pounds, and they're doing it for like $16 to $18 an hour. So and then we got the ER nurses sometimes, and God bless us. God bless every one of us for the things we have to deal with.
It's true.
We're giving them flack. I'm like, we need to just be nice. We're got to be nice to each other and be nice to the nice EMS folks.
Absolutely.
I mean, they got it hard.
They have a tough gig. They have a tough gig too. So.
Well, yeah, and again, it just comes to mutual respect and understanding the roles. It's different. It's kind of funny as a flight nurse, Kevin, because so I go to scene calls, I rendezvous with these people, and I remember being an ER nurse and kind of sometimes a little bit of friction, the joking about the ambulance driver butt wiper kind of just banter.
Yeah.
Because half of these guys were my friends, so I got away with it. But you go out to these rural places, and the paramedics are ashamed to call us. They're apologetic for calling us. They're like, I'm sorry this isn't done. I'm sorry this isn't done. And they seem like they're embarrassed. And I'm kind of looking at it. I'm like, you have nothing to be embarrassed about. I'm here for you. You did a fantastic job. I mean, it didn't occur to me, how hard their jobs were until we had to set down our helicopter for it was a warning light. But, precautionary reasons, our pilot didn't want to fly with a warning light.
Yeah.
Same time, we had a very septic person who was intubated, had one IV, and it was sweating out because his fever was broke. His tegaderm was literally pulling off its skin. We were about to lose it. And, in a sequence of events, of course it was the middle of the night. Of course it was hot. We were running out of sedation. His pressures were junk. And, we had to wait for another helicopter to come get us. So, and when the other helicopter came to get us, and there's no light. We're trying to get another IV in this tiny helicopter. So I'm trying to hold a flashlight in my teeth, and he's kind of bucking the sedation. Cow. So I'm trying to use a knee to pin down an arm and start another IV. My partner's trying to work with the vent and get him sedated and hand me things, and we're crawling over top of each other. And then after all this, trying to move all of our patient, all of our equipment, all of our narcs over to this other running helicopter while simultaneously making sure that the firemen who are sweet enough to stay on scene with us don't walk into the spinning blades of death in the back.
Yep.
So it's something that you don't have the perspective of kind of what your cohorts are doing out in the field until you've lived it. And it's insane. These people are working with no light, no resources, no help. Yep. And then that's just some of them. You get real rural and it's just EMTs. God bless them. No wonder they call us.
It's fun. And do you find the same thing in the hospitals where, the hospitals call, a smaller hospital calls to get somebody transferred to a larger hospital? Do you find they tend to do the same thing?
Oh, absolutely. Absolutely. I can't tell you how many times I've had nurses that are just ashamed of their work. And I'm like, you have no reason to be. You're a tiny hospital. You don't have all these things. You are a small, tiny, little ER who just, I can't, okay. So one example I'll give you is that we have a little hospital that basically works as a little Band-Aid station. It's the middle of nowhere, hooked to a residential building. And staffed by a family doctor. They do what they can. They handle most of what they do, and they recognize their limitations. But they seem so embarrassed. Whenever you get there, they just seem like they're ashamed of the work they've done or that they've called you. And it's you have no reason. Like, it'd be one thing if I was going to a level 1 trauma center that have every resources available to them and every education availability, and then you screwed the pooch really bad.
Yeah,
I mean, don't
it's
get me
different.
wrong. Things happen and people make mistakes, and patients are never, predictable. So don't get me wrong. But you go to these hospitals where people are doing the best they can, and they feel ashamed of whatever they didn't do or don't have or don't know. And it's like, you got no reason to.
Yeah.
I mean, the thing is it's funny because whenever I'm in the ER nurse role, and I'm just in my regular scrubs, I'm treated so differently than when I put the flight suit on. It's like completely different. Like, I don't know if I'm intimidating, and I'm a small person. I'm all a 4'11". Okay. I'm this tiny little human who just like, I once had an ICU patient ask his nurse why there was a child running around the ICU when I walked by.
That's
so
funny.
I mean, if that gives you kind of an image of what I look like, I'm just this like little tiny, not intimidating human, but people suddenly just kind of like act differently when I show up. And I think it's that kind of like, they think I know everything. And I wish I did. I work with a lot of people that have forgotten more than I will ever know. And it's like, wow. And I want to be there. Like, don't get me wrong. I know a lot. And I know more like this month than I knew 4 months ago. And I knew 4 months ago more than I knew 6 months prior. So it's like a constant evolution. But at the same time, I'm not a superhuman.
Yeah.
I am just another human, just like you. I probably make mistakes just like you. But it's just, I think that because of the fact that I have so many credentials and I've proven myself so many times, and I can, that I can work under pressure, and that I've done this, that people find that maybe I'm scary. I don't know. But it's just funny because people treat you different. Like, doctors talk to you different. Like, if I make a suggestion on something based on maybe our treatment algorithms and our protocols, they're like, yeah, let's do that. Whereas if I would have asked to intubate a patient, maybe when I was an ER nurse, like, they might have said, no, not indicated kind of deal. But, now I'm like, can we intubate this patient? They're kind of like, yeah, let's go ahead and do it. And it's just weird. It is a weird comparison to put side by side. And for the longest time, I couldn't make that kind of jive in my head. And then I kind of realized that, this is the top of my game. Like, people are really expecting you to show up and be the top. Like, they expect you to like meet this ideal that you are this superhuman, and you're really not. You're just another person. But they expect this of you. Often you show up and you are their rescue team. Like they are so relieved. Like, you see this kind of relief show up. Like, yeah, saviors are here, and it's like, really is not a superhero, but okay,
Yeah, like,
I'm here to help.
Yeah, you're like, we're here to help, and we'll do what we can.
Exactly. And the funny thing is that I'll be the first to admit this. Good ALS always starts with good BLS. So a good medic understands the worth of his EM. A good flight nurse understands the worth of her medic. A good flight team never underestimates the worth of good ground medicine, good ER medicine, good ICU medicine. It all is intertwined. Like, we're a team. So if all you were able to do in that ER was get an IV on a patient that has nothing for veins, you know what? I am happy about that, because it's one thing I would not probably be able to do in the helicopter.
Yeah.
I mean, really, if that is all somebody is able to do, that is not a damn thing to be ashamed of.
Yeah, about. You're like, hey, that's something.
Yeah. The only thing that is really kind of a pet peeve is that when you show up and everyone kind of just like scatters. And it's like, okay, I need to talk to somebody. I need a little bit of help. Come on back. It's okay. I will not bite you. Come on back. Come on back.
Yep.
But other than that, it's and I had 2 real bad traumas over this summer. One really good outcome, one really bad outcome. Same EMT, same company, within like a week of each other. And the EMT, we went to the debriefing after the bad call, and the EMT said during the debriefing, kind of looked at me. He's like, I didn't want to tell you that day, because it was a pediatric code. I didn't want to tell you that day. He's like, when I saw you get off the helicopter, I was really relieved because at least I knew your face. And I was shook because I didn't know the CMT real well. I ran him with the trauma the other night, and I knew he was devastated from this particular call. We all were. It was real hard, but it was just something about that rapport and that trust and that sense of relief. It's a real heavy burden, but at the same time, like, that is a real honor that people kind of like feel. I got goosebumps right now. It's really weird.
Yeah.
It's that sense of like responsibility. And it makes you want to live up to that. Like, people depend on you, not just your patients, not just your patients' families, but like the colleagues you work with. Like, you have to meet up to their expectations because they feel relieved when you show up.
Yeah.
Like, that the help is there. It's like the cavalry is coming in.
That's the honor of, it's like, I had an instructor who used to always say, it's an honor to take care of people, and you should always treat it as such, because, whether you realize it or not, they're never going to forget you. And, sometimes we forget that's true. They're never going to forget us. And even though we may forget, unfortunately, we may forget them just because, the nature of our work, but still there's going to be patients, 5-10 years down the road that they're going to see you and absolutely remember you.
And I think that's so true. I think one of the problems with the burnout in our career is that too often people take us for granted and we let them. We let it. It's cumulative. We let these traumas kind of build within us until finally we look at our careers and we're like, what was it for? But too often, I think we lose sight of really the meaning of our work. These petty things that people come into the ER for. I've tried to refocus my perspective in the past few years. People are in crisis. Crisis has different definitions to different people. So what we see as true emergencies, obviously is different than what people see as emergencies. But for whatever reason, they've come to us because they trust us.
Absolutely.
And, it might be something as goofy as, the homeless man just wanted to come in because he trusted that we would help take care of the needs that he's not meeting. Yeah, he's there for the 5th time that week. Yeah, he needs a shower. Yeah, we're out of turkey sandwiches. But it was a trust. He knew we would be reliable. Is it manipulative? Probably. But he trusted the system would work for him because he was in crisis. This was his defense mechanism, his coping strategy. It doesn't mean it's right, but too often I think we're so busy being annoyed and trying to justify in our heads why this person's not worthy of us because it's not a true emergency but I've tried to pay more attention to those humans and try to find solutions. Do they always take them? No, but I sleep better at night.
Yep. That's true. And it's one of those things that, I remember I was talking to somebody recently about the fact that, it always kind of hurts my heart a little bit when I hear these nurses and, they're like, oh, damn patients. And, oh, this frequent flyers here all the time. He just wants a turkey sandwich. He just wants a warm place to stay. And it's like, well, sure, that may be the case, but they need stuff, they need help, and they're there because they need your help, and they're expecting you to do that. And if you don't, or if you can't, then, shame on you. I had a conversation with somebody recently, and if you don't know this person, if you don't know Kristen Klein, you guys need to meet, because you guys would be 2 peas in a pod. Also a flight nurse, also just an incredible human. But we were talking about it just the other day, and we were talking about how, in the Facebook chat groups, someone was kind of complaining, oh, these dang patients, and complaining that, the patient was hungry. And it's like, well, the patient was hungry. Like, what's there to complain about? Like, is that turkey sandwich coming out of your check? Like, is that going to hurt you? You're complaining because this guy has the physiologic need for food. I mean, come on. How do you complain about that?
Well, and it's so true. I mean, I think we forget when we look back to Psych 101, we look back to fundamentals of nursing. What is Maslow's hierarchy of needs? Where does it start? Yeah, shelter. Okay, ER, got a roof over our head for now. Our homeless don't usually have that. But then you work your way up this hierarchy of needs. Nobody ever meets self-actualization if they don't meet those base animal needs. It is so base, Kevin. Like, people forget this.
Yep, you're absolutely right, and it's a broken system, and the only place they have to go is the emergency department. But by golly, it doesn't make their need any less. So, and I think it's important for people to always remember that. So, it's one of those things that the one thing I hope that if this podcast has any impact on anyone ever, I hope the impact it has is just reminding people about the heart of what they do, and just reminding people of that, because, you never know, like, no matter what an asshole that patient is, somebody loves that asshole. And they're affected by what's going on with them too.
And that's a perfect point. And this is something that I've always maintained, is that no matter whom you come into contact with, at one point, that was somebody.
Yeah.
If they're not right now, they were somebody. So that's somebody's mom. That's somebody's brother, friend, teacher,
absolutely
neighbor,
right.
Pastor. Nobody finds pleasure in being dirty, disgusting, looked down upon, addicted. Nobody finds pleasure in that. Nobody likes being bad or defined as, as the scum of the earth. Nobody, I think we lose this sight as our own community, like, oh, another overdose. They're just going to end up dying anyway. But what the problem is these people's issues have run so deep. This is how they survive. Like, these people have been abused as children, neglected as children, grown up in households with drug abuse, poverty. We forget that didn't start there usually. I mean, there's people that did start for the high. Don't get me wrong. I'm not saying everybody's perfect and everyone's damaged, but we do forget that trauma is highly associated with substance abuse. And we forget that it's associated with homelessness. And we forget that mental health is tied to a lot of trauma. So, we get all these things that we are annoyed about because they're not true, cardiac arrests and strokes and heart attacks and traumas. They're these, like, not soft emergencies, but they're not like, we feel like these people have done it to themselves somehow, but then we forget the whys. And when you look at some of we look at these statistics, and they're staggering about the veteran population. They certainly didn't do it to themselves. I don't think that you take a man in uniform who stood proudly, and I don't think he's proud of where he is. So he doesn't need us adding another layer to it.
Absolutely. And I think just, people remembering that is that, again, that's somebody, and that's a person. That's, a human being just like you and have needs just like you.
And it's funny, I wasn't going to get into this really, but I was a survivor of a bunch of mental health things. I'm a survivor of sexual assault. And when I was through my teenage years, it was a struggle for me. It led me down a path of why I made the decisions I made. So I was sexually assaulted as a teenager. I went for my master's in forensics so I could figure out how to help women. I went for SANE training so I could figure out how to help women because I recognized there was a need. Yeah. We look at these women and we look at these men and we look at these people in crisis. I survived a lot of issues with my mental health. I attempted to commit suicide my first year in college, which was another reason why I failed so many of my credits. So it was in addition to like having fun and being a lax student, I also had a huge breakdown. So when I say about overcoming adversity and being better, it's because I did. I pity a lot of younger female, patients that come into our psych rooms because they often get labeled as these acting out for attention or things like this. I would rather a girl act out and ask for attention and find me than to not ask at all and commit suicide.
Yeah.
It is the absolute loneliest feeling. It really is. I mean, when you get to that point where you've hit rock bottom, it's hard to drag yourself out. It took me I want to say a couple years to really heal from the emotional drama and trauma really that I went through. But I remember this and I use this empathy for my patients. And the joke was in my ER, I was the psych whisperer. Innately somehow like psych patients just liked me. And I know we're not really supposed to divulge personal information to patients. I really do. And I respect that. But somehow I felt this need for these young girls to see that you can survive and there's hope. So I would tell them, I'm not you. I'm not living your life, but I survived. I mean, I was very depressed as a teenager. I attempted suicide as a teenager. But you can move on. You can survive. It's survivable. You just have to ask for help and take the help.
Yeah.
But I think, again, in the emergency department, we're just too busy. We've got too much stuff coming in. We don't get a chance to really, take those opportunities, these lessons that we can, give to these young girls, young boys too. I shouldn't really even say just young girls, these young people.
It's both. Yeah.
And, I think that's another thing I just take a lot of pride in as being a flight nurse is because I overcame a slew of things in my life, of my own doing, not my own doing, just a whole bunch of things.
Yeah.
And I think I can hold this up, very proudly and be like, look, I did a thing. I'm very proud of my thing. I worked very hard for my thing, but I had a lot of support helping me do this thing. And I want to be like a person that if you ever you may never see me again, but remember my words. I care about you. Your life is worth living. If you ever doubt that, just remember the one nurse in that one ER who told you that you were worth it. You know what I mean? And I was really proud of that. I may have gone home and felt really good about that moment. I never did see that one girl again, though.
I gotta tell you, and it's moments like that may be a defining moment in that patient's life. That may be the time that they decided that things were going to be okay. And
I really want to think that.
And I mean, you just never know how you may have touched that person, and just that one little act of kindness, and that what to us is just an everyday thing, and we don't think much about, like, to our families and to the patients and their families. It's everything. And I think people forget that.
And, I think that's something that when we start to look at our careers and we question the burnout and we question, all of this, I think that's something we can kind of fall back on is, look how much I in my own life, whatever anybody's lives have really been, look how what I accomplished. Somebody can look to me and be like, look, they made something of their life. I mean, being a nurse, being a tech, being an EMT, being a paramedic, doctor, being housekeeping. It's good work. You're doing good work. Everything matters.
Yep,
I think it's something that keep your head held high because it makes it's positive role modeling.
Yep, exactly.
I mean, if not for the patients, think of the generations to come that we're influencing. And I just love it. That's become my legacy now is how can I impact the next generation? Which is really weird to think because I'm 29. So here I am thinking about my legacy.
That's cool though. And that's cool that you're forward thinking enough to realize that even at 29, your shit matters. Like how you do what you do defines who you are. It defines who you are and it matters. And it matters your work ethic and your dedication to your profession. All that stuff matters. Well, Steph, this has been a lot of fun. This has been a great conversation.
Well, I appreciate the opportunity.
Oh, my pleasure.
I had a lot of fun with this.
My pleasure. I have too. Like I said, it was a lot of fun. So
thanks for listening to the Art of Emergency Nursing podcast. Make sure to subscribe to the podcast and follow us on Facebook.